One of the other things that you've done, which is so interesting, both informational and eye-opener, insightful, and entertaining, and that is psychiatry in the movies. And you've done quite a bit of that over the years. You also published a book about that.
Yes, Psychiatry in the Cinema.
Right, and some of our viewers might like to buy that and see how the image of psychiatry has evolved over the last few decades. What do you think? Has our image improved? Does the media understand us?
I don't think they'll ever understand us, We're, I said at the beginning, we're kind of a beleaguered specialty, and there's a kind of ambivalence about psychiatrists, because they, people are sort of in awe of us, but they also kind of like to devalue us as meaningless. And the film depictions all, I think, portray this ambivalence of the ineffectual blank screen who does nothing and says nothing, the Woody Allen films, the evil psychiatrist who tampers with chemicals in your brain and does procedures on the patient, and the Hannibal Lecter psychiatrist who eats his patients, which, by the way, is not listed in the ethics code as an unethical behavior, so maybe that's okay.
We should put it.
We should add it to the ethics code. But, I think there's a real kind of question about what we do, and we see this in real life too, that someone is on a plane with you and they say, what do you do? And you say, I'm a doctor. And then I dread the question, what kind of doctor? A psychiatrist. And then they go, oh, are you reading my mind?
Already.
Already. And so there's we see this, and the films simply capture the public's concern about whether we are a legit specialty and if we can really be effective in what we do. So it teaches us something about transferences to us that everybody has.
True. But it's really important because millions of people watch those movies, and they basically confirm their worst perceptions of misperceptions of who we are and what we do.
It's so true, and
it actually impedes some of them from coming forth.
And some people don't have any contact with the real psychiatrist.
Correct.
So their whole contact is TV and movies.
This is it. Yes.
And they're the other thing I'd have to say is the way that psychotherapy is depicted is often in a totally different universe than real psychotherapy. For example, a common thing I've heard over the years is the patient who says, aren't you going to hypnotize me and try to recover a repressed memory? And they think that's what the therapy is, and I have to explain that that's not what it is. They say, well, in such and such a movie, that's what happened. And so they don't really know what to expect. Exactly. And the movies will give them a very skewed perception of what it's all about.
You've written about The Sopranos and In Treatment, stating that these are actually somewhat closer to what psychotherapy is actually like for patients and for clinicians. Have you seen anything since then? The Sopranos now being 10 plus years old.
You mean on TV?
Whether TV, whether movies, literature, anything since then that is encouraging?
Not really. And Peirce, the reason is pretty clear. Good psychiatric treatment is not showbiz.
Right.
It's kind of dull and methodical, and it doesn't play well on a screen, whether it's in your living room or in a movie theater. And you have to jazz it up to keep the audience's attention, because if someone put a video camera on me in my office and showed me doing psychotherapy, and then they tried to sell tickets, people would demand their money back. And they say, there's nothing entertaining about
no
this.
Drama.
No drama. So, there's a huge problem with that, the only way that we can make psychotherapy or any kind of psychiatric treatment interesting is to make it sort of unrealistic.
Right.
So there's an irreducible problem, I'm afraid.
And couch it in sex or violence,
or even like in treatment and some of the others that are somewhat better. They still have characters getting up, walking around the room, and the therapist never stays in his chair. They're all over the place just to have something going on.
A restless psychiatrist.
That's right.
Another area that's really one of my favorite topics, actually, and yours too, and that is how people devalue psychotherapy. They think talk therapy is cheap. Talk is cheap, right? That's the same. But we believe it's a very therapeutic tool. And one of the interesting things that you and I share is that psychotherapy is really a biological treatment. It changes the brain. Can you elaborate a little bit of that, about
Okay,
that?
sure. Well, let's begin with the premise that the only way a treatment could work is if it changes the brain. So
Okay.
psychotherapy would have to change the brain to be effective. Now, this is part of the Cartesian dualism that we've gotten into in psychiatry,
Yeah.
where medication is the biological treatment, psychotherapy
Right.
is the psychosocial treatment. But one of the best things that's happened for psychiatry, and I think, and also for psychotherapy, is all of the neuroimaging studies, which now show brain changes connected with a psychotherapeutic intervention, in some cases overlapping with medication, in some cases not. So that we start to think differentially about how psychotherapy affects the brain and how medication affects the brain. And, you know, this is tremendously valuable as to educate the public, because, you know, they can watch movies and think psychotherapy is nothing more than hand-holding or babysitting or being a parent,
Yeah.
you know, a friend.
And minimalize it.
Minimalize it. And I think that the neurobiological trends in the field have really helped the view of psychotherapy as a
Yes.
legitimate treatment.
Absolutely.
When I lobbied in Washington, I remember Congress people and senators being very skeptical that psychotherapy was a real treatment. And you may remember in the famous confidentiality case in the Supreme Court, which was Jaffe versus Redmond, it was on confidentiality, but Justice Antonin Scalia wrote in the minority summary that it would be of greater benefit if you talk to your mother rather than to a psychotherapist.
Oh, jeez.
You know, and again, here's an educated man in a prominent position saying that psychotherapy is actually inferior to just talking to a parent.
And
So-
that's generational.
Yeah.
He's about 75.
That's right.
And you know, in those days, that's what really counted. Talk to your mother more than.
That's right, but that's the kind of stigma
Yeah.
that we're
It
always
is a
working
stigma,
against
yeah.
in psychotherapy.
Should be careful what he says.
Yeah.
But I appreciate it. Peirce, you have any last questions?
One last question I have
Sure.
is, what, as far as the frontiers of psychiatry, looking down the road, anything that particularly excites you, whether it be psychopharmacology research, whether it be imaging, whether it be genetics, epigenetics, anything that
Well,
you look
I
forward
think
to?
there is a very exciting area that combines the research on the impact of genes and environment with family therapy. Like for conditions that are thought to be untreatable, such as antisocial personality, we're now getting some interesting data from a New Zealand prospective study that there is a genetic vulnerability to antisocial personality, which we've known about for a long time. But this tends to be influenced by early childhood abuse, so that if you have the MAOA gene and you also then have childhood trauma, you have a greater risk of becoming antisocial than if you don't have the trauma. So that one could conceive of targeting high-risk families where there's been abuse or cases that have come to the social services attention, and try to make family interventions early on to help the parents be better parents.
Absolutely.
And then maybe prevent some of these genetic vulnerabilities from actually reaching full penetrance.
From expressing, yeah.
From expressing themselves,
That's extremely exciting, and I think you know, in medicine as a whole, we're finding that gene and environment work together. It's
Yes.
not either or. Nature, nurture are together working, like you said, to either express it in a big way or maybe suppress it.
Well, one of the paradoxes here, Henry, is that with all the genetics research, what it's making us realize in psychiatry, we have to be very modest in how much genetics is involved, because there are environmental
Yeah.
factors that determine what the genetic expression will be.
Absolutely, and then the epigenetics gets even more
Oh,
interesting.
yes, that is it.
Where your behavior before you ever got the children might actually change your gene, not change the gene, but either silence them or express them.
Yes.
So I can conceive in the future a very exciting answer to your question, because I was thinking about that too, is that we can actually suppress the genes of mental illness in a family where we know that runs by behavioral changes, even dietary changes, before the pregnancy takes place, and the kid may have the gene for schizophrenia or depression or anxiety, but it's silenced. And that would be extremely exciting.
Yeah, yes.
Well, it's been so exciting to have you with us today as a
My
visiting
pleasure.
professor. Thank you so much for
Thank you,
being
gentlemen.
here.
Very much.
Thank you very much to our viewers for being with us today.